Imagine taking your healthy baby to a doctor for a routine medical procedure, and then something goes catastrophically wrong, and your child is permanently injured. Then, while desperately searching for help, you meet a celebrated psychologist from one of the most respected medical institutions of the world. He promises that your child can still live a happy, normal, healthy life, but only if you follow his instructions. Remove healthy organs, change the child's name, keep the truth a secret, and raise your son to be your daughter. And allow the doctor to use your children to prove one of the most influential theories about human gender ever proposed. That psychologist was Dr. John Money. And the children at the center of his most infamous experiment was Canadian twin brothers, named David Reimer and Brian Reimer. But before I begin, despite the horrific allegations surrounding his work, I could find no credible evidence that John Money was ever criminally charged or convicted for what happened to David and his twin brother Brian. He was not a convicted child abuser. He was not a convicted pedophile. He did not go to prison. What happened was to expose publicly, condemn ethically, and discredited scientifically, but never prosecuted in court. And that might be one of the most disturbing parts about this entire story. So John William Money was born in New Zealand in 1921. He earned a doctorate in psychology from Harvard and eventually became a professor of medical psychology and pediatrics at Johns Hopkins University. Although people commonly called him Dr. Money, he was a psychologist with a doctorate in it. He was not a physician or a surgeon. Money became one of the most influential sexologists of the 20th century. He studied sexual development, intersex conditions, transgender patients, paraphilias, hormones, and what he calls psychosexual development. He helped popularize terms such as gender role, although the common claim that he single-handedly invented the concept of gender identity is a little bit of an exaggeration. At the center of Money's work was the belief that a young child's gender identity was extremely flexible. He believed that during the earliest years of life, a child could be assigned either male or female, and if the doctors and parents acted early enough, could successfully be raised in that role. Biology mattered, but according to Money, consistent upbringing, appearance, and social conditioning were enormously powerful. The whole nature versus nurture argument. This became known as the optimum gender of rearing model. For children born with atypical sex characteristics, Money supported choosing one sex as early as possible and then surgically altering the child's body to resemble that sex, using hormones when necessary, and raising that child without hesitation or uncertainty. In many cases, children were not told the full truth about their bodies or medical histories. These ideas influenced how generations of children were treated. And then, in the 1960s, Money was presented with what he believed was the absolute perfect opportunity to prove his theory. David Reimer was born in Winnipeg, Manitoba in August of 1965. His birth name was Bruce, but for this video I will continue to call him David because that would eventually become his chosen name, and I will respect that. And he had an identical twin brother named Brian. The twins were born completely male, there was no intersex. But when the boys were approximately 8 months old, they were scheduled for circumcisions because of concerns about their foreskins. And unfortunately, during David's procedure, a doctor used an electrocautery device, and the procedure went catastrophically wrong. And David's penis was severely burned and almost completely destroyed. And obviously, Brian's circumcision was canceled due to that. And their parents, Ron and Janet, were completely devastated. Reconstructive options for infants were extremely limited at that time, and the family did not know what kind of future their son could have. And then they saw John Money discussing gender development on television. So they reached out to him at John Hopkins, and Money told him that David could be reassigned and raised as a girl, like it was just matter of fact. But to Money, these identical twins created for him an extraordinary research opportunity, and that's all he cared about. The boys shared basically the same DNA. They shared the same biological parents, the same home, and the same prenatal environment. So he figured one could be raised as a boy and the other could be surgically altered and raised as a girl, all to prove his theory. Because Money effectively had an experimental subject and a comparison subject living in the same family that had almost the exact same genetics. So, on Money's recommendation, David underwent surgery at approximately 22 months old. His healthy testes were removed, making him permanently sterile. His external anatomy was surgically altered to appear more female, and his name was changed to Brenda. His parents were instructed to dress him as a girl, treat him as a girl, and never ever reveal that he had been born a male. And as David approached puberty, estrogen was prescribed to cause breast development and other female secondary sex characteristics. And Money also recommended additional surgery to actually construct a vagina, but David strongly resisted and the full surgical plan was never completed. Now, Money referred to the twins anonymously in his publications as the John/Joan case. And publicly, he presented his experiment as a success. He claimed that David was developing like a girl and contrast David's supposedly female behavior with his brother David's masculine behavior, and the case became widely known in medicine and psychology. It was presented as powerful evidence that gender identity could be shaped primarily through early upbringing. But behind that published success story, the experiment was failing. David resisted dresses and stereotypical female toys. He preferred traditionally masculine activities. He stood while urinating when he could. He reportedly felt deeply uncomfortable being treated as a girl and was bullied by other children. He did not understand why everyone insisted that he was female when something deep inside him told him otherwise. And as he grew older, his distress became more and more severe. And the treatment sessions at Johns Hopkins allegedly became even more damaging. According to David and Brian's later accounts, Money subjected the twins to what he described as sexual rehearsal play. The brothers alleged that Money would make them remove their clothing and participate in genital examinations. They said he made them inspect one another's bodies. They alleged that he forced them to assume sexual positions together, with David placed in the female role and Brian placed in the male role. They described being instructed to simulate thrusting or intercourse-like movements. And according to their accounts, Money sometimes showed them sexual material and photographed them in at least one sexualized position. And the brothers said that Money would become very angry and intimidating when they refused. These are allegations based primarily on the brothers' later testimony and investigative reporting by journalist John Colapinto. They were never tested during a criminal trial because Money was never prosecuted. However, the brothers' accounts have become a center part of the documented history of this case. Money apparently believed this so-called rehearsal would teach the children the difference between male and female sexual roles. But by any reasonable modern ethical standard and moral, directing two young siblings to stimulate sexual behavior would be a profound violation of clinical and moral boundaries. The twins were children. They could not meaningfully consent. Money held enormous authority not only over the children, but their parents as well. And according to their testimony, they were frightened, humiliated, and pressured to obey. And it got to the point where David flat out refused to return to Johns Hopkins. By his early teenage years, he reportedly threatened suicide if he was forced to see money again. And I think that scared the parents, because at approximately 14 years of age, David's parents finally told him the truth. They explained that he had been born male and that the circumcision had destroyed his penis, and the doctors said that you should be raised as a female. And for David, that truth was devastating. But it was very freeing and also explained his entire life. And he immediately began living as a male again. He got off the estrogen. He began receiving testosterone. He chose the name David, reportedly after the biblical David who defeated Goliath. And then he would go, over the next many years, underwent a double mastectomy to remove the breasts that the estrogen caused, and received many procedures to create a penis. He had a artery removed from his leg. He had a big chunk of skin removed up from his arm. He had scars from the mastectomy. That man went through a lot of pain just to feel like himself again. And luckily, David did eventually marry a woman and became a stepfather to her 3 children. But the psychological damage did not simply disappear. And the scientific problem was also enormous. Money had publicly presented the case as a success, yet the person at the center of the experiment rejected the assigned identity. Money did not promptly publish a clear and prominent correction informing the medical community that his famous case had failed. So in 1997, sexologist Milton Diamond and psychiatrist H. Keith Sigmundson published a long-term follow-up of David's case. The report revealed that David had never accepted life as a girl and returned to living as a male during his adolescence. Journalist John Colapinto later brought David's story to a much wider audience through his article and the book As Nature Made Him, The Boy Who Was Raised as a Girl. The experiment that had been used as proof of Money's theory was exposed as a devastating failure. Money's work had consequences far beyond one family. His theories contributed to a medical culture which infants born with intersex traits or differences of sex development were often surgically altered at very young ages. Doctors sometimes removed reproductive organs, reduced or removed sensitive genital tissue, constructed vaginas, or otherwise altered children's bodies before the children were old enough to understand or even consent. Now, some procedures were necessary to protect the child's physical health, but others were primarily intended to make the child's body appear more typically male or female, or aka normal. Patients would later describe a loss of sexual sensation, infertility, shame, secrecy, repeated examinations, and the trauma of discovering that important information had been withheld from them. Money was not personally involved in all these cases, but his theories helped provide an intellectual and medical justification for early and irreversible intervention. His career also contained other controversial areas of research. Money and psychiatrist Richard Green studied boys who displayed behavior considered feminine at the time. Their work examined whether childhood gender nonconformity predicted homosexuality or transgender identity later in life. This research came from an era where homosexuality and gender nonconforming was frequently treated as a medical or psychological problem requiring correction. But Money also worked with consenting transgender adults through the Johns Hopkins Gender Identity Clinic. This needs to be distinguished from the Reimer case. Adult patients requesting treatment for themselves were fundamentally different from an infant having an identity and irreversible procedures imposed upon him. Money also worked on the hormonal treatment of convicted sexual offenders. He helped develop the use of medications such as Depo-Provera to reduce testosterone levels and sexual drive. This treatment is sometimes called chemical castration, although it does not involve surgically removing the testes. And at the same time, Money wrote extensively on paraphilias and age-related sexual attractions. He coined the term chronophilia to describe sexual interest centered on particular age groups. Some of his writings drew distinctions between violent or sadistic abuse and what he described as affectional pedophilia. Critics argued that this language dangerously minimized the inherent exploitation involved in sexual contact between adults and children. I agree, because regardless of whether an adult describes such contact as loving or affectionate, a child cannot provide equal and informed consent like an adult does. There is no credible evidence that Money himself was convicted of molesting a child or that he personally had a sexual relationship with one, but his views remain disturbing, particularly when examined alongside the twins' allegations about what happened during his treatment sessions. Brian Reimer struggled severely after the experiments. He developed serious mental health problems, and unfortunately, he died from a drug overdose in 2002. And at the time, David was also struggling, and then adding the grief on top of marital difficulties, financial stress, employment problems, the trauma of going through that. On May 4th of 2004, just 2 years after Brian, David died by suicide. And it would be irresponsible to claim that John Money alone caused either brother's death. Suicide is complex and rarely has one cause. But according to David and Brian, Money's treatment left both of them with profound and lifelong lasting trauma. John Money himself ended up dying in 2026 from complications of Parkinson's disease. And unfortunately, he died without being criminally tried for the treatment of the Reimer twins. There was no courtroom verdict, no prison sentence, no legal reckoning. His story is not simply about one controversial psychologist. It is a warning about what happens when authority, ambition, and ideology are placed above the person being treated. It is about the danger of treating a human being as evidence for theory. It is about irreversible medical decisions being made for children who cannot consent. It is about research controlling the information, declaring themselves successful, and ignoring the suffering that contradicts their conclusions. And most importantly, it is about remembering the people behind the experiment. David Reimer was not Joan. He was not an experiment. He was not a case study. He was a human being whose body, identity, and childhood were placed in the hands of adults who believed they knew him better than he knew himself. And Brian was not merely a control subject. That was David's younger twin brother, another child who was pulled into an experiment that he never agreed to join. John Money became internationally respected because he claimed his experiment proved that he was right. David Reimer spent the later years of his life telling the world what that experiment had actually done. And although Money was never convicted in a court of law, history's judgment of his most infamous work has been devastating.